provides me with information that I can use in determining my own care. It gives me the opportunity to take more responsibility for my own health and to make decisions about how I want to proceed and what options are available. I spend a lot of time looking at journals and looking at current research, and that information is very important to me. For me, the concern about asymmetry is that if you're, a member of an HMO, for instance, and there are two, say, medications available for a particular disorder that have been shown to be relatively ineffective and both about the same, but then there's a third medication that HMO's formulary doesn't cover, you will probably never even hear about that. And without that knowledge, you can't either go and fight the HMO to have it put on their formulary, or have the option to perhaps pay for it yourself.
In terms of FDA, I would say to treat patients like responsible adults and give them access to all the information that there is, and particularly when people have terminal illnesses, when it's all about quality of life, let responsible adults and family members make decisions for themselves about even experimental drugs, as long as they are really fully informed.
I do read the journals, and I do have a background in research, so it's easy for me to do that now. But as my disease progresses, I'm going to be less and less able to do that. And I will be in a position, probably, I don't know when, but in the near future probably, where I will be like many other people who have lost that ability. And so we need to not only have the information available, but we need to have trusted sources, trusted people who can interpret that information and make it available in a way that is understandable to the average person.
And I'm a nurse, and so it's not a question for me of so much understanding a lot of this information as it is that I have a very full-time job, which is very demanding. I'm 61, almost 62, and as Steve becomes less independent, that will be more of a demand on me as well. So I will have neither the time or the energy to spend reading research. So at that point, it's going to be really important that Steve's medical providers have all of the information.